If you are thinking about hair transplant and comparing results, and if you are really mesmerized by seeing some results on internet which are showing very full results in one session, they have covered the entire area, saying that we have done 4,000 grafts, 5,000 grafts, and you are wondering how could they achieve these results, and you are totally surprised and shocked to see how this density could be achieved. You need to know a very important fact, that all these hair might not be because of transplant. I'm your friend Dr. Shaiil Gupta. I'm a hair transplant surgeon. I've been doing surgeries for past 20 years. I have seen this dangerous trend where people put the patient on a lot of medicines, a big number of PRPs post transplant. Especially, I'm talking about finasteride, which is a DHT blocker. The medicine can have some sexual side effects, we all know, but and you may develop tolerance to the medicine in few years. That is a different issue. But one shoe does not fit all. So one strategy applicable to all, I don't think it's a good idea. Many of you might not need this medicine at all. Many of you might need this medicine quite late in your life, maybe not now. If we start the medicine now, then obviously everything comes with a shelf life. So if you think that the effect is going to last for another 5, 6, 7, 10 years, and you will keep taking the medicine for another 5, 6, 10 years, then I think you need to rethink the strategy. So a lot of patients are put on finasteride when transplants are done, and sometimes a huge number, which is sometimes not possible, 5,000, 4,000 by FUE alone, is being done and justified just because of finasteride. So when you are going to a clinic, ask them, "Are you going to give me finasteride?" And please be very straight and ask them, "What's your plan, doc? Are you going to give me finasteride post transplant?" So if they say yes, then ask them, "How long do I need to take it? 6 months?" Some might say 1 year. Some might say. Some might say, "Okay, after 1 year we'll see and reassess and all that bluff." Ask them, "What will happen if I stop the medicine after 1 year? Are you ready to take the medicine forever? Do you really think you can take the medicine forever? And is it the correct dose? In case you are planning to take the medicine, is it really wise to take it at 1 mg per day daily? Have you come across studies which show that a very small dose of of finasteride can also work? Are you overusing your such an important acid, which is finasteride, or are you using it too early? As I told you, everything comes with shelf life. So what's the benefit, of prescribing finasteride to the clinic, to the surgeon? There are a huge number of miniaturized hair which you see, which are there even in apparently completely bald areas. Many a times when you see pre-pictures, a lot of people shave off the head and take pictures, and it seems as if the guy is bald, uh, but he has a good number of hair. So those are like photographic tricks. But yes, if finasteride is prescribed to a patient who has undergone a transplant, the miniaturized hair present in that area will improve significantly, and actual transplant result will be doubled or tripled in many cases. So you might think that actually a good transplant where a good number of grafts were placed, but finasteride was not given. You might think this transplant did not achieve that density, but comparing it to another transplant where finasteride was given, and you think this is a great transplant, even if they have done less number of grafts, stating more. So, you know, that's an unfair comparison. And if somebody, see, as a surgeon, I also can give finasteride to all of my patients. And I know that I will get a great photo opportunity at 6, 7, 8 months. But, it might not be good in long term interests of my patient. So, it is up to you, please. And in case you are planning to go get a transplant done, and if you and your doctor are planning to give finasteride, then take it for 5 6 months before getting a transplant done, and then you see many of you might not need a transplant at all. Everything will be taken care of by finasteride. I'm serious about this, and it will save a huge money and number of grafts also, and your donor also. So nobody will be able to sell you fake numbers of grafts as well. So this is a good advice. I think you should follow this.